Okay, now on parasite control, this is done in horses every 2 weeks, no? But there are even farms that I've encountered that would deworm their animals every month, no? Because the and the parasites are everywhere in their pasture, no? So that's an unfortunate thing. They really have infestation of this and the parasites in their horses, so that's why they have to deworm every month, no? And this becomes very expensive for them. The better way for it to be addressed is to adjust the pasture, no? Why it still has eggs of endoparasites. And they have to rotate the area, no? So that's part of the pasture management that was discussed earlier to diminish the level of endoparasites in the environment, okay? So we usually deworm our horses using this tube, no? So we have this on the far side, the oral paste syringe, and it comes in in many deworming families. So not only for fenbendazole, you also have that either as ivermectin plus prazolam, no? So this nasogastric tube preparation usually only has this ivermectin plus praziquantel or ivermectin, no? Honestly, I have not encountered this product. So this is available abroad. So what is usually available here in the Philippines would be the oral paste syringe or the feed additive. But the really famous one or the common administration that we would do is through the syringe, no? So if we have like 20 horses, so you would have 20 syringes. So one per head, yan. Tapos, depending on the size or on the weight of the horse, no? So there's already a particular dosage for that. So you would not, sometimes be consuming everything that is in the syringe. So you don't have to really throw them right away. You can just store it or label it, no? So you can use it after 1 month or 2 months, no? Because the expiration also takes about 3 years before it will really expire. So you can, really finish the tube before opening a new one. Okay. So fenbendazole is a more famous deworming form that we give to horses, but we can also use that albendazole as well, no? Fenbendazole is just safer in terms of, margin of safety. It has a wider margin of safety rather than albendazole. Albendazole would be stronger, so that's the trade-off. And we usually use fenbendazole for pregnant animals, no? For pregnant horses, for mares, no? And also the common ones to interchange with this albendazole family would be praziquantel and then ivermectin. So sometimes, we also, of course, we also have to repeat, no, using different dewormer. Even usually also every time we deworm every one or every once a month or every 2 months. Okay. Yan. This is also what I was telling about earlier, the parasite management. So you group them by their age. It's like having a communal um pasture time, no, or grazing time. And then you have to also minimize overcrowding. So same principles as what you have learned from the other farm animal production courses. And in the pasture area, you may also have like a trough where you will put in the hay. But usually, the feeding of hay is done as when they are already inside their stalls because this is done individually. Okay. But if you have to give any supplemental food while they are in the pasture, it's advisable that it's elevated and it's not on the ground. So they will have less exposure to having to have the feeds or hay contaminated with soil, and then the soil will be with this endoparasites or eggs of endoparasites. We also practice only allowing them to graze starting 10 a.m. onwards. And that is to ensure that there is no more dew on the grasses, because the parasite eggs would be on the droplets, on the dews, um, in the leaf blades of the grasses, no? So if you practice having to pasture them very early in the morning, okay, you can expect that you can have these endoparasites, no? Especially if you have not really treated your pasture. Okay, and then not so much actually with horses, because they, I mean, because usually also they are being pastured in a vast land. So you don't have really much, but it's just so if you graze your animals, you also be prepared to have the capacity to really remove their manure from the pasture area, no, be it manual or automated. And you have to have an area where you dump them, and to also manage that dump site, no, you have to dry the manure properly. And if you decide to reuse it, no, for fertilization, I mean, bringing back, no, the nutrients from the manure going back to the soil, no, if you decide to do that, make sure that the manure is very much dried already, no, before you can really use it as biofertilizer. Or if you have any um, plant propagation anywhere in the farm, no, located anywhere in the farm, then you may also use it as biofertilizer for as long as you really keep them 100% dry. Okay. For pasture preparation, no, same as with the other land preparation. So you have to deweed them, no, you have to deweed them on a regular basis, especially if you're just starting with preparing the land. And there's actually a process with that. And you start with disc plowing, then after at least 2 weeks, 3 weeks to 1 month, then you do the next step, which is disc harrowing. Okay, so you pulverize the soil coming from the large chunks made by the disc plow. Okay, and then from pulverizing it, of course, you're going to kill some of the roots of the weeds, but still some of the weeds will still emerge. So in 2 weeks after the first harrow, you reharrow again. Okay, so it makes it like the the soil particles a lot more smaller than the first one. And then pag nagbuhag-hag na siya, no, so then it's easier to then have your new plant, no, establish their root system as compared when it's cake, no, or very, very dry or very, very hard, no. Okay, and then other than that, no, so if you have to establish pasture lots depending on the density of your horse population, okay, so that you can utilize your land in a cycle that would be more than 21 days, no, just to disrupt the regular cycle of endoparasites, no, which is, di ba, usually 21 days yung incubation period nila before they grow into the mature stage. So, kaya have the capacity to rotate pastures in 30 days, no, and not any earlier than that, okay? Now, more on the vaccination types. So these are just the required vaccinations here in the Philippines. And this is a lot less than what is being done abroad. So tetanus is definitely a must, no? So we give tetanus toxoid, and whenever they undergo any trauma, they get cuts, no? Especially if they run towards their fences and then they bump the fences and then they get cuts wherever, be it in their forelimbs, in their chest area, no? Then you have to give them tetanus antitoxin, okay? So they have this on a regular basis. So the first one, the first dose would be given at an age when they are 2 to 4 months, and the booster shots would be given 4 to 6 weeks before foaling. Okay. And this is to be repeated every year, because the horses are very prone to tetanus. So tetanus is a bacteria that can be found in the soil. So it's present worldwide, present everywhere. And as mammals, we can also be affected with tetanus. So that's why whenever we have any cuts in our body, also undergoing surgery, etc. So we are also advised to get these tetanus shots. Okay. Next would be influenza. So this is equine influenza. And we have two types, okay, equine influenza 1 and equine influenza 2. So this has respiratory infection, okay, and we are very strict with these shots if the horses are racing horses or they are being shown, no, because it being like respiratory route, no, or yung aerosol droplets. So we fear that those that have not been vaccinated will be very much in danger if they are housed in cubicles or in areas or in stables where all the other horses have been vaccinated. And if one is positive with this influenza, it highly contaminates or like spreads the disease to the other horses that have been housed in the same area. So we start with this shot as when they become 6 months of age. And then depending on the vaccination status of the dam, okay, we can give them a booster every 6 weeks until they are 7 months, no? Okay, so it's like having just two shots. So one when they are 1 month old, and then another one, a booster when they become 7 months old. Okay, and then the booster happens so often such that when the horses is being raised, no, so they get exposed to a lot more other horses, so they get revaccinated every 2 to 4 months. Okay. And then for those that are at the farm, no, the brood mares, these are your breeding animals. They just stay at the farm. So they get a longer interval, which is every 6 months. Okay. And then again, same as when with the tetanus, 4 to 6 months before foaling, they get another booster, no? And that is basically to give immunity to their foals. Okay. So the other vaccination that is being done abroad that is not done here is rabies. Like especially in the United States, they are very much concerned with rabies in horses, so they do vaccinate rabies to horses there. Okay. Other than that, here in the Philippines, we are very particular with equine infectious anemia or EIA. And the horses should have regular testing and they should have a negative result. And that is to be checked by the Bureau of Animal Industry. So they are very strict such that only licensed veterinarians are allowed to take blood samples and submit it to the regional animal disease diagnostic laboratories. Okay. And the veterinarian is to be escorted or observed by an LGU representative, no? So there's even this, like I know a horse vet that would have to pick up the LGU representative from the office and then bring it with her at the farm to witness that she really did a blood sample coming from this horse, okay, and then send it to our ADTL, and then bring back that LGU staff to their office, no? So ganun siya ka-strict. And how I wish it's really being practiced with the other animals as well, no? Okay. And next we have equine herpes type 4. vaccination program. So this is actually not this is not mandated. No, this is not mandated. So you may or you may not vaccinate your horses with this herpes virus type 4 vaccine. So if you are to vaccinate them, okay, mares are vaccinated at 0, 3, 7, and 10 months of the pregnancy, no? So that is before they get bred, when they are confirmed to be pregnant at 3 months, 7 months, and 10 months, okay? So herpes virus, same as with herpes with humans, it has a reproductive infection. Okay, and when we have our yearlings now, they are to be vaccinated when they become 1 year old, and then 13 months of age, and then 14 months of age, if their mare has been vaccinated. And then all the other adult horses are to be vaccinated annually. Okay? Yan, so ito yung sabi kong sa rabies, no? In the States, the primary dose is given as and when the foal is from 2 to 4 months of age, and then there's also an annual booster. Okay? So parang same lang siya actually ng protocol ng sa dogs and cats. So 3 months of age. So if you don't want really to memorize a lot more numbers, so just copy what we do with the small animals. So at 3 months of age, we also vaccinate the foals. The strangles is present in the Philippines, but yeah, we still see strangles in the field. We do vaccinate them, okay? But this is not required, no? So yung required lang talaga yung kaninang nasa table earlier. So we give 3 doses of 3 weeks apart, starting as when they become 2 months of age. And then after the 3 doses, there will be a booster vaccination every 6 months for high-risk areas. And if not, this will just be done annually, no? Tapos, again, pre-foaling, so to protect the foals, the mares will undergo the booster vaccination 4 to 6 weeks, okay, before the estimated foaling date. Yan. Okay, so that's it for the health protocols. Do you have any questions?